I'm going to talk about today is urban tree cover impacts on air temperature and heat-related mortality. And this work is jointly done with a great team. The names are on this slide. Ravi Colville, Satoshi Hirabayashi, Brian Lin, Ted and Rennie, and Dave Novak. Three of them are on the line. Thank you for joining, guys. And we would like to acknowledge funding from the NUFWEC grant, of course, some internal funding from RTI International, and a lot of this work wouldn't have been possible if Jen Richfus hadn't made the connections and put together this team. So I would like to acknowledge all of them and presenting on everybody's behalf today. So the background and motivation for this work is really to look at a specific type of ecosystem service. Tree cover in urban areas, as we all know, provides a large number of ecosystem services, runoff reduction, aesthetic improvements, noise reduction. These are just a few examples. There are other benefits of urban tree cover, and the focus that we will, the focus of this project is primarily air temperature changes. And previous work has been done on building energy savings and associated power plant emissions, for example. Our focus is to really look at reduced heat-related health effects. And the question is, why do we need to quantify and value these ecosystem services? These estimates of benefits can really help decision makers in a variety of different ways. As all of you know, in urban planning, scenario assessment, advocacy, benefits or co-benefits of different environmental policies. What we are going to focus on today is adaptive strategies to address public health and environmental justice issues resulting from particularly extreme heat. So what are the methods and models that we use? Our work is based on, the launchpad for our work is really I3, which quantifies and values a lot of urban forest benefits, as a lot of you know. It already incorporates, for example, improvements in public health due to air pollution reduction. So again, we are going to expand that work and focus on reductions in mortality, specifically due to reduced air temperatures. And so health impacts of temperature. So why are we interested in this question at all? So of course, we've been hearing a lot on the news about health impacts of extreme summer temperatures. It's one of the leading causes of weather-related deaths in the U.S. At the moment. And there are some statistics that are up on the slide. In short, the number of deaths due to extreme heat is extremely large. And the other perspective to this is that a lot of people with specific characteristics are more sensitive to extreme heat than others. And this, of course, raises a lot of environmental justice issues as well. And so this problem is going to become even more pressing in the future with changing climates and aging populations. There are a lot of studies, especially recently, on projections of heat-related deaths, and they really show huge numbers of increases in projections there. And so it's not just in the U.S., there are similar trends around the world, and some of the work that we are doing, the framework can be applied to other parts of the world as well. And so the need to develop effective adaptive strategies to address some of these issues is really increasing at a pretty quick pace. The challenge, however, is that there are a lot of variations, both spatially and temporally, in the health implications of these temperature changes. And so just coming up with tools, methods is going to become even more important for policies, for designing policies. And so that's the focus of this study, is to expand I3 to include a new temperature module that will add a benefit category for the existing I3 users, but will also expand the suite of users to look at health and EJ issues related to extreme heat. So, so some of the key outcomes of this knockback project, I see there as being three clear parts to this. The first part is the method and framework, and this was actually a bulk of the work in kind of making the links between pre-cover, temperature, mortality, and economic values in one consistent framework and tool. And the advantage of this kind of tool is you can tie these, you can tie temperature projections to this kind of framework pretty easily. The other advantage of this kind of a mechanistic and modular link is you can, the research in this area is constantly evolving. So we want this to be something that is updatable and more, and something that can be enhanced over time as new research becomes available. And there's a lot of flexibility that the existing framework is developed that it gives you a lot more flexibility than more simplistic relationships between pre-cover and health impact, for example. And so just also looking at where are the impacts, when do they occur, at what point during the season, who might be impacted, all of these questions are really important for efficient and effective decision making. And so that was the first piece of it, and it's really a lot of the meat of the work is there. And then we implemented this work for Baltimore City, where we established and kind of demonstrated the method, we refined it, and this method can be applied to other locations. And we did look at impacts of vulnerable communities. So our main focus was on age. So we focused on the age group for over 65-year-old people. And so this of course, would help address some of the EJ and public health issues that we've talked about before. So then the next piece to this work was really looking at the variation in estimates of these mortality benefits across 10 different U.S. cities and kind of trying to understand, are there differences across the cities? If so, what factors drive these differences? And then, that kind of information can really help inform policy analysis, especially when you need to do some kind of extrapolation from one location to another, for example. And then the other thing that it lets us look at is impacts of trees on hot versus cool cities. So it lets you develop adaptive strategies across different types of cities. So to describe our method very briefly on one slide is a little bit difficult, but there's a little graphic which shows our four-step approach. So essentially, we first look at tree and impervious cover data from NRCD and for our area of choice. The second step is to use this tree cover data to estimate reductions in air temperature due to the existing tree cover. And to do this, we look at we apply the I3 cool air model, and that is based off of Young et al. 2013. And my collaborators on the phone here, Ted and Robbie, really helped develop that piece. Along with others at the U.S. Forest Service and DD Tree. So the step 3 is really to to apply what is what is called a health impact function, and essentially what it does is it translates the changes in temperature into changes in mortality using health information of different kinds. So one is, what are the mortality rates, the baseline mortality rates across different age groups, what's the population in each age group, and then the change in heat really comes from the I3 cool air model, and then we apply relationships between heat metrics and mortality from the epidemiological literature, and we particularly use a couple of studies that are referenced there. And then the next step really is kind of translating the changes in mortality and into monetary benefits. So what are the dollar values associated with these changes in mortality? And so that's just a very quick overview of the method that we established and then followed in Baltimore as well as the other cities. And so the second piece to the method piece is really what are the scenarios, what's the coverage like, what's the scale. And so the scenario that we look at is really 10%, increasing existing tree cover by 10% of each census block group's area. And why do we choose this kind of scenario? So we looked at a lot of these tree cover goals from different cities, and this was roughly within the range of different tree cover goals from different cities. And there's a reference there which has a very nice summary of different tree cover goals across cities that we found very useful. So this is again intended to be an illustration and demonstration. The study can, of course, incorporate other kinds of scenarios as well. So we looked at two different types of changes, one focusing on extremely hot days and the other focusing on changes throughout the season. And the question, the tricky question here is, what do we mean by extremely hot days? And so what we have been using is city-specific thresholds. So whenever the temperatures cross historical thresholds, and we use 99th percentile as our cutoff, which is what the epidemiological study that we apply is based on. So whenever the temperatures in a particular city crosses that city-specific threshold, we use that to define our extremely hot days. And so doing that allows us to allow for acclimatization, which is a pretty important consideration for looking at health impacts of heat. So what I mean by that is, of course, that 90-degree Fahrenheit temperature in Chicago is very different from a 90-degree Fahrenheit temperature in Phoenix, for example. And so we allow for that by using these city-specific thresholds. Then the spatial coverage, we look at Baltimore City, we look at 10 cities across different climate regions, land cover, population, demographics. We look at the census block groups. We focus on the summer season between May and September 2011 is our data set here. And then we look at daily changes and then aggregate over the season. So some key takeaways from the Baltimore case study, when we looked at a 10% increase in tree cover in each census block group, our estimates of reduced mortality was ranging between 84 and 251 deaths, which is pretty high. And so the economic value of this is also very high. It's in the range of a couple of $billion. And so the other interesting finding was that over half of the reduced mortality is from the over 65 age group, who are extremely vulnerable to extreme heat, and that kind of points to the great value of increasing tree cover to actually to address these kind of EJ issues for vulnerable populations when thinking about extreme heat. And so the other interesting find was that the greatest reductions in temperature were really, in downtown Baltimore, if you can see the dark blue shaded area. But if you look at where the impacts were, they were more in the outskirts. And so you see that the mortality impact, which is in the middle of the middle map, lines up with the map, the purple colored one on the right-hand side, which is really the population. And so that was a very interesting finding for us, that really the benefits, the mortality benefits are not necessarily where the temperature changes occur. It's also where the vulnerable people are. And just so for the 10 cities, it's a lot to condense into this time spot. So we'll focus on a few highlights. What this slide shows is, changes in per capita mortality in percent terms, percent of as a percent of baseline mortality. And again, we look at across season and extremely hot days, and Phoenix really is on the top of the list for both of those days, and really shows that it stands to gain a lot from increasing tree cover by even 10%. The interesting thing that we find is for Minneapolis, which didn't seem to gain a lot for looking across the city, at least, in relative terms across the city, the ranking was number 10, but it moved up to number 3 when we were starting to look at extreme hot days. And that, again, we found is really very, it tells a very striking story there in terms of, how effective tree cover can be even in the cooler cities. And so just to summarize some of the key takeaways from the analysis of the 10 cities piece to this. So we really find that it impacts very widely across the cities. And we did a very in-depth analysis of why we found these differences, which is hard to describe in detail here. But essentially, it boils down to difference in demographics, in baseline land cover, and also local climatic conditions. The main driver for these differences we found were the local climatic conditions. Hotter, drier cities have higher impact. And so this certainly has a lot of policy implications, because you need to figure out what are the factors in each city if you want to start doing extrapolations, if you have to do extrapolations. It's not ideal to be doing them, but if you have to, you need to think about the factors. And so the study kind of points to some of that. And then the other thing is the impacts are not evenly distributed across the season. Hotter, drier months have most impact, and therefore public health interventions need to be designed to address that. And then impacts vary spatially for all the cities, and it's not just the distribution of the temperature changes, it's also where the population is, and this has tremendous implications for EJ and equity. And then the other thing, of course, is that cooler cities may show less impact during, an average summer season, but if you're looking at heat wave conditions or extremely hot days, it could really make a huge difference. And that, again, has a lot of policy relevance going into the future under climate scenarios. A lot of the cooler cities in the Midwest and Pacific Northwest really have higher heat-related death projections than a lot of the other parts of the country. And even the frequency of heat waves are projected to increase. So it really shows that, increasing tree cover in such cities can be a very powerful tool in addressing some of these issues. So just to end with a a couple of different sources that you can look at for more information. The Baltimore manuscript is now available publicly, and the citation is on the slide here. It's also publicly available at the Forest Service on the Forest Service website, and we have a little project profile up as well. And thank you very much for attending, and looking forward to questions and discussions.